Good day everyone. I'm Keyuri Bhanushali, a creative professional, an MDR TB survivor and an SATB fellow. I am here today to share my thoughts about TB and undernutrition with you and to introduce you to a wonderful panel of experts from India and Nepal to discuss the same. TB and undernutrition are both problems of considerable magnitude and importance worldwide, and especially in high burden TB regions like South Asia. The role of nutrition is as important as that of medication in recovering from TB and generally staying healthy. As a survivor, I can't emphasize enough on the importance of eating right and staying fit. Our immunity plays a vital role in protecting us from diseases and in helping us avoid reinfection. The COVID-19 pandemic, however, has disrupted TB services in this region, including social support mechanism, and many patients and families have suffered income losses. This, coupled with lack of social support, has led to food insecurity, insufficient nutrition, and an absence of social support system for many. I was lucky enough to have my parents support my nutritional and medical needs. But unfortunately, that isn't the case for a large number of patients in India and Nepal. It is critical to ensure that the nutritional needs of these affected populations are met, and the road to that is food security. We need to focus on making our population food secure and healthier, not just provide them with diagnosis and treatment. Without further ado, let me introduce our panel. We have Dr. Madhavi Bhargava presenting on TB and undernutrition, understanding the correlation, followed by Chapal Mehra highlighting what India needs, and then Dr. Chandra Prasad Acharya from Nepal discussing the way forward for ensuring nutrition support and food security in Nepal. Here's looking forward to great discussion.
Hello everyone, I am Dr. Madhavi Bhargava. I teach in the Department of Community Medicine at Medical College, and I am also Deputy Head at the Center for Nutrition Studies, and I have been working in the area of TB and undernutrition for more than last 2 decades. We have been able to generate evidence that has brought nutrition to the center stage of TB care in India. So when I talk of TB and undernutrition, it is just an example to show how nutrition is important in health and disease. It is not just important in communicable diseases like tuberculosis, but they are also important. It is also important in non-communicable diseases like diabetes, hypertension, and even cancer. It has a role in development of the disease, its progression, its response to treatment, and treatment outcomes. Now, coming back to TB and nutrition, the usual argument that we face when we talk of TB and undernutrition is that whether it is a cause or an effect. We know that TB causes weight loss, but at the same time, we also know that it is more common in people who are underweight. So it's the usual chicken and egg story. Then what we are asked is whether it is a risk factor or a comorbidity, whether it's a biological risk factor or a social determinant. So without going into these circular arguments, what we need to understand is that the answer to all of this is yes. Let me outline the various correlations between TB and undernutrition. One, it is a risk factor as well as a comorbidity that affects the severity of the disease. It affects the treatment, and it also affects the outcomes in these patients. So let us look at each of these in detail. Nutrition plays an important role in immunity of our body. So malnutrition is supposed to be a leading cause of acquired correctable immune system dysfunction, and it has been rightly called as nutritionally acquired immunodeficiency syndrome, NAIDS. We have estimated that about 24% of TB, almost 1/4 of TB in high TB burden countries is due to undernutrition. And if we look at India, 1/3 to nearly half the TB cases in India can be prevented if we tackle undernutrition at population level. So it is one of the most important low-hanging fruit in public health intervention when it comes to TB prevention. Undernutrition, when it is present in patients with tuberculosis, it increases their disease severity. There is higher degree of lung destruction. They have greater cavitation, which means that they are more infectious. Moreover, they have delayed sputum conversion during treatment, which means that they remain infectious for their family members and household contacts for a longer period. Now let's see the treatment part. So it does affect, undernutrition does affect absorption capacity in patients. So in children, it has been found that rifampicin levels were found to be much lower in undernourished children as compared to normally nourished children. Similarly, they do not tolerate anti-tuberculous treatment as well as normally nourished people. And drug-induced hepatotoxicity was found to be 5 times higher in patients who had severe undernutrition. What happens to these patients who are undernourished at the end of the treatment? If patients with normal BMI have a relapse rate of 5.8%, studies have found that relapse is almost 20% in those who have lower BMIs. Mortality is almost 2 times higher if patients have lower BMI. And if we require 7,500 kilocalories to gain 1 kg weight, if we do not provide adequate nutrition to these patients, they fail to gain weight during treatment and continue to be underweight at the end of treatment. With these poor weights, they remain unproductive individuals. They cannot go back to the work and cannot support their families. Cash benefit transfers is a very important step in addressing undernutrition in patients with tuberculosis in India, but it is not enough. We can think of in-kind support as well. And most importantly, whether it is cash or kind, we need to add enablers to patients and their families where we empower them to understand how to utilize this cash and kind support as best as possible so that they become productive individuals at the end of treatment. Once we agree on all this, we will find best possible ways to implement this. Thank you.
Hello and welcome to this important discussion on India's 2 silent co-epidemics, tuberculosis and undernutrition. As many of you know, TB and undernutrition both exist at a massive scale in India. So when they work together, the results are devastating and cause enormous suffering to millions of Indians and poor people and vulnerable folks across the world. COVID-19 has made the world and India come to a standstill. It dominated the headlines, but in this mayhem, we forgot that India has 2 long-standing problems, those of undernutrition and an ancient disease called TB. We also overlooked the possible impact that these will have when working together. It's important to understand how TB and undernutrition work together. Poverty and resulting undernutrition increase the chances of active TB disease and also the severity of the disease. It reduces the patient's speed of recovery, exacerbates side effects from the medicine, and the likelihood of them suffering the possibility of mortality. So, while TB treatment and the numbers may have increased in India over the last several decades, it's unlikely that we will be able to control TB until we address comprehensively the causal relationship between undernutrition and TB. Despite economic progress, even today, an increasing number of people remain undernourished, without food security, and this particularly includes a large number of children, women, tribal populations, and other economically marginalized and disadvantaged groups. When undernutrition is combined with various other causes, the total incidence of diseases like TB is bound to rise. As employment opportunities are difficult in India today and elsewhere, and migration to other states is widespread, these challenges are bound to grow. Not just that, low nutritional levels can often lead to worsening of various side effects that TB patients face. Survivors and patients have reported loss of eyesight, severe weakness in limbs, leading to prolonged bed rest, constant fatigue, and body ache. These are just some of the few things they have experienced. So what can governments do here? A few years ago, India launched the Nikshay Poshan Yojana, NPY, a nutritional support program for TB patients who cannot afford sufficient nutritious food. This is a well-intentioned scheme, but it is also a case study on why good intentions are rarely enough. The scheme's design and conceptualization was done without consulting any of the survivors or end recipients of the scheme. Also, its implementation is fraught with challenges, including delays, non-receipt of payments, and demand for excessive documentation. There is little doubt that the amount under NPY today, which is a mere 500 rupees, is insufficient and must be raised for all TB patients at least to rupees 2,000, as is the case with HIV-affected communities. There is also a case for state-specific ration assistance scheme for patients whenever possible. Now, why are we having this conversation? Why is this urgently needed? According to the latest research, even with government assistance, 50%, and I repeat that, 50% of TB patients and their families suffer financially devastating expenditures as they struggle to satisfy a patient's nutrition and other medical needs. What does this do? It drives them further into poverty and makes them even more vulnerable to TB. We must also recognize the rural, local, and regional shortcomings that plague schemes like NPY. We need to guarantee that TB-affected individuals eat a well-balanced, tailored diet, and we can meet their nutritional demands and needs. In India, we have made the bold claim about eliminating TB by 2025. While the COVID-19 pandemic has clearly dislodged this target, it's unlikely that we can control TB if we do not address undernutrition, both as a preventative but also as a curative tool in TB. It is critical to understand that the nutritional needs of India's TB populations must be met, and the road to food security must be achieved. We must focus on making our populations food secure and healthier, not just providing them with diagnosis and treatment. If we continue to neglect the nutritional needs of our populations, we may be creating a long-term disaster that we cannot manage in the future. This is my submission to this discussion. I look forward to hearing from the differing panelists, but also from each of you. I urge you to engage in this important discussion so that we can come up with ideas to address TB and undernutrition together. Thank you.
Namaste. Me, Dr. C.P. Acharya, chest physician working in Manipal Teaching Hospital. Today I am going to talk about TB and undernutrition and its problem in Nepal and its plan. So we are covering the topic like TB and undernutrition, prevailing nutritional status of TB patients, repetitive nutrition concern of TB patients, importance of nutrition during medications, the impact of COVID-19 on undernutrition and TB, and what needs to be done during going forward. What is tuberculosis? The TB is the sixth leading cause of mortality in Nepal according to WHO National TB Prevalence Survey briefly done on 2020. More than 1,17,000 people affected with TB are living in Nepal today. In 2018 only 32,000 was present and 54 cases are missing. TB death among registered TB patients was 3%, that is 1,019 among 30,464 registered TB cases in physical 2019 and 20. Now, what affects the nutrition? Undernutrition affects a third of the adult population and food insecurity remain high in Nepal, with 1/4 of the population falling below the poverty lines. 36% of the child population are stunted, under 5, 10% are wasted, and 27% are in underweight category. This is the status of the current status of Nepal because of undernutrition. Prevailing nutritional status of TB patients. So, despite the undernutrition rates declining substantially over the last 2 years, Nepal is still considered to have one of the highest rate of undernutrition in the world. Anemia among women, adolescents, and children remains high level public health concerns. In Nepal, 41% of women of reproductive age and 46% of pregnant women are anemic. In Nepal, malnutrition has been shown as a strong predictor of TB among half of the all active TB cases. That means those persons who are undernutrition has a chance of tuberculosis also. TB and undernutrition. Understanding the correlations. So TB cause weight loss and low body mass index, as we know all. A surrogate for the undernutrition is a risk factor for TB infections. So that means we are all clear that TB itself causes weight loss, and those patients who are undernutrition has a chance of developing TB, and those patients who are with the TB treatments and undernutrition, they have a chance of complications. The association between TB and malnutrition is bidirectional, which we have discussed. TB leads the patient to malnutrition, and malnutrition increases the risk of developing active TB by 6 to 10 times. So it is a directly proportional. And nutritional concern of the TB patients. What the TB patients should have for maintaining the status. Multiple forms of malnutrition, such like undernutrition, protein malnutrition, micronutrient deficiency, and overweight and obesity have been associated with the TB. And similar deficiency of iron, folate, vitamin A, vitamin D, and zinc, etc. are more important. Anemia is strongly related with the childhood TB. Nutrition during intensive and continuation phase of medication. Being underweight increases the time it takes for a patient to recover. It further increases the side effect from the medication that the patient takes, thereby increasing the chance of becoming one of the many who die TB in Nepal every year. Nutrition among TB patients during pandemic. What is the status of the TB patient during pandemic? The National Tuberculosis Program Nepal pre-pandemic provided nutritional and transportational allowance of NPR 3,000 per patient month as a social protection cost to drug-resistant tuberculosis patients in the country, because we all know that this multi-drug or drug-resistant TB are not nearby. So transportation facility is provided. The COVID-19 outbreak has exacerbated food insecurity, thus putting the migrant and labor population vulnerable to the risks of the hunger and malnutrition. Way forwarded. Nutrition subsidiary scheme to the poor and unprivileged. A broader and more comprehensive food security target at a poor vulnerable population, including unemployed and migrant, is needed. It is important to ensure nutritional and financial support to the people suffering from the tuberculosis. With growing craze over Western cuisines, it is essential to promote advocacy on the importance of our traditional dal bhat as a source of balanced diet among with the community peoples. Awareness campaign on nutrition and diet among TB patients as a crucial aspect of the TB treatment. Thank you very much.